Hi everyone, my name is Celeste. I chose to do my presentation over fentanyl. And so this presentation will just be a little bit about fentanyl, kind of an introduction, abuse statistics, treatment options, just things like that. So, a little introduction to fentanyl. It was originally developed in 1960 by a Paul Jansen. The medication was in originally intended for, pain use. It's an opioid just like your morphine, heroin, other opioid drugs. But this fentanyl was found to be more popular or more powerful rather than things like morphine and heroin. It became very popular in clinical practice for pain management use and just kind of went from there. Fentanyl has very high potential to be synthesized and mixed with other illicit drugs, and this has been happening since the 70s. This led to an increase in fentanyl related overdose deaths and just overdoses in general, even if the overdose did not end in a death. But since 1979, fentanyl has been made in labs and sold as heroin substitutes and has been being mixed with other illicit drugs. And in 2006 is when the surge in fentanyl related deaths kind of began happening, that's when people started really to become aware that the surge in deaths was related to fentanyl. So, fentanyl use in the United States is very high. An estimated 110,000 people died from drug overdose in 2022, and 70% of those deaths were from fentanyl or other synthetic opioids. It is one of the primary drivers of overdose in the U.S., and fentanyl being produced illegally and in labs and outside of the medical field can contain lethal doses depending on a person's body size. So this drug is not a one size fits all type of situation. A very small person can die at a dose that a very large person would not die from. Most drug organizations distribute fentanyl by the kilogram, and 1 kilogram of fentanyl has potential to kill over 500,000 people. Some risk factors for just overdose from fentanyl and fentanyl abuse. Those dealing with acute and chronic pain and are prescribed fentanyl or other opioids for pain management are at higher risk for becoming addicted to fentanyl. Long-term use of the drug can increase your risk for addiction, and being prescribed higher doses of the medication can increase risk. As far as it being a risk for overdose, whether it be accidental or not, older adults, people that already suffer from respiratory issues or respiratory depression, and people with impaired strength are more at risk for overdose when taking fentanyl, because fentanyl does cause respiratory depression. So if you already have medical issues that cause respiratory issues, then you are more at risk to overdose from using fentanyl. When it comes to risk for abuse or unintentional overdose, younger adults, people with mental health disorders, and people with a history of drug or alcohol abuse are more at risk for abusing fentanyl, even when it's prescribed by a physician. When you have that type of history, being prescribed fentanyl or any other opioid can increase your risk for misuse. So some short-term side effects include digestive issues like nausea, vomiting, constipation. These are the types of things that you might see even when prescribed, a medically appropriate dose just by your doctor. Same with migraines, Dizziness, confusion, hallucinations, all of those things can be relatively short-term side effects. More long-term effects include tolerance, dependence, and then experiencing withdrawal symptoms when you don't use the drug. Signs of addiction, especially when it kind of comes to being a provider and seeing these patients in a session, changes in behavior, becoming very avoidant, not talking as much, seems like they maybe aren't being fully forthcoming or honest, wearing long clothes, especially when it's not appropriate for the season, could be a warning sign that maybe there's some addiction. Physical changes like small pupils, decreased responsiveness, changes in their appetite, increased drowsiness if they're falling asleep in the middle of their session or being very slow to respond, seems like it's taking them a long time to process what you're saying. Those could also be signs that may need to be looked into. Requesting early refills or reporting that their pills are missing or have been stolen. Those would also warrant a little bit of research and just kind of diving deeper into what's going on with the patient. So, fentanyl has a very high potential for overdose and use in suicide because, as I mentioned earlier, it's a very lethal drug and it's very lethal even in small amounts. So, that does make it very easy to overdose and very easy to use in an overdose suicide. So even if the intention was not suicide or self-harm, it is still very easy for an accidental overdose to happen, especially whenever the drug is being bought off the street, like I said, because you can't really monitor how much of the drug is in these pills or, powders that people are snorting or how much that they're injecting. You can't really monitor how much of the actual drug is being ingested, and therefore it makes it very easy to accidentally overdose, but also makes it very easy to intentionally overdose even with very small amounts. So as far as treating these patients that are dealing with addiction, medication-wise, you have options like methadone, buprenorphine, naloxone. Those are kind of your typical medications that are going to be used for most opioid addiction treatment. Another thing that you may use pharmacologically is Narcan, and that's more of just prescribing the Narcan for the patient to have with them at all times so that in the event of an overdose, it's available, it's with them for someone else to be able to use and care for them. Non-pharm options, detox programs and rehab programs, outpatient therapy would all be recommended and could be useful in sobering up the patient, detoxing, rehabbing, and then continuing sobriety. As far as education, one of the main things I would educate on is kind of what to expect with that withdrawal and detox period, especially if they do not have a history of abuse, and maybe this is their first time going through a situation like this. That detox period can be very painful. It can be very psychologically hard. Sweating, nausea, constipation, diarrhea, hallucinations, tremors. It can be a very overwhelming time, and so it's important for them to kind of know what to expect and prepare themselves going into that. So as far as referrals, like I said, inpatient detox, rehab, outpatient therapy. Also providers for medication assisted treatment. Not every provider, just because they are a psychiatric provider, that does not mean that they are certified to prescribe those medications for substance abuse. So it's important that they're given referrals for providers that are able to prescribe those medications and be able to be set up with them. As far as follow-up, I would want to see a patient pretty immediately after discharging from detox or rehab just to establish that care back and create new goals and care plans as their psychiatric provider. Even if I'm not the one that's going to be able to prescribe their substance abuse medications, I would still want to see them pretty frequently. And as we move further into their sobriety journey, be able to decrease the frequency of those sessions as we see fit. So, in conclusion, fentanyl was originally created for pain control. It is an opioid that does have very easy and high potential for abuse and misuse, has very high lethality. It is very easy to overdose on this drug. You always want to assess for risk factors, whether it be risk factors for accidental overdose, like those patients that have respiratory depression and maybe just need to be a little bit more careful, or if you're assessing for risk factors of, abuse and misuse, like patients that have a history of abuse or patients with mental health disorders. There are multiple options for treatment that include medication or without medication if the patient isn't comfortable with that, or if they just need therapy or whatever type of non-medication treatment to continue after detox and rehab. And that is all. These are my references. I hope you guys enjoyed it. Thank you.